have a strange title for you today. Pick your poison, diabetes or heart disease. So what am I getting at? I listen to various doctors speak about things, and I'll be honest, they're not too complimentary when it comes to talking about their patients and talking about Americans' ability to be disciplined and make healthy choices in their lives. And personally, I've always been a little insulted by that because for 40 years, we've been having patients make beautiful changes in their diet and lifestyle. So where this comes from is there's been a lot of talk about saturated fat of late, and you have the carnivore enthusiasts saying, saturated fat is fine and it's not going to increase your risk for heart disease, which has not been substantiated at all. It's pretty darn clear that saturated fat is going to increase your risk of heart disease. And considering that, here are my stats, every 40 seconds somebody has a heart attack, every 33 seconds a person dies from heart disease. These are scary statistics and they're very real, and I think it behooves us to really understand the correlation. Where the diabetes discussion came from was listening to two doctors kind of argue about the fact that, if you cut saturated fat, then people are just going to increase their sugar and refined carbohydrates, and that's going to lead to diabetes. And with diabetes, you've got obesity and you've got fatty liver, and you have increased risk for heart attack also. So it's better if they stick with the fat. And it's like, wow, it's not so black and white. How about you cut the saturated fat and you use monounsaturated and polyunsaturated fats, which don't have this high risk? How about instead of refined sugar and refined carbohydrates, you actually do complex carbs and appreciate the fact that fruits and vegetables are carbs and beans are carbs, and there's a lot of great foods that are not going to lead you to very high glucose levels and cause your pancreas to be overburdened, leading to diabetes. This black, white, good, bad, it's not that simple, yet it's also not that complicated. So let's discuss it a bit. So where do we find saturated fat? Let's go back to that for a second. If you want to do a little analysis of how your diet is doing, you want less than 10% of your calories to come from saturated fat. So if you're an average American consuming about a 2,000 a day calorie diet, that's less than 200 calories coming from saturated fat. And in countries like Japan, and we talk about the Mediterranean diet, we're not talking about, unfortunately, today's Mediterranean diet. We're talking about the historical Mediterranean diet, which was very healthful and keeps coming up over and over again as the diet that leads toward the best longevity. So if you look to Japanese diets, Mediterranean diets, they were in that 6 to 7% of their calories coming from saturated fat. They were getting most of theirs from fermented goat's milk, fermented cow's milk, like yogurt. So they were getting it from a good source, so the fermentation as a benefit. But just looking at some basics, I looked up what a burger is. So a burger has 5 grams of saturated fat, and for every gram of fat you get 9 calories. So it's 45 calories. So that's not bad. And then, but you look at a cheeseburger with 3 patties, and now you're up to 20 grams of saturated fat, which is 180 calories, and that's it. You're done for the day with that saturated fat. And then for the dairy, 1 tablespoon of butter has 7 grams of saturated fat, so it's 63 calories. So you're getting up 1 tablespoon. I harken back to my childhood and butter on the corn on the cob in the summer. And that adds up pretty fast. A tablespoon of coconut oil, so these tropical oils like coconut and palm oil, a tablespoon is 12 grams of saturated fat. That's 108 calories, so you're over 50% depending on how many calories you consume in a day. So it would be a decent exercise to say, okay, what's real for me? What do I actually do? And just kind of keep track for a week and get an idea of where you are. And you can make some very good inroads by decreasing your saturated fat. Now, per this doctor, he was saying, well, you tell them to not eat the butter and they're just going to, they're going to find the fat-free Oreos. That's what they're going to do. And maybe, if not educated, that could be a direction. It's like, oh, well, my doctor said to cut my fat. So what sounds good that says fat-free? Sure, that's out there. And certainly those food companies are taking advantage of the fact that you're looking for low fat. But we need to educate ourselves on what real food is. So when you're trying to eat less fat, you have polyunsaturated fat, monounsaturated fats, which are very healthful. Getting back to the Mediterranean diet with olive oil, so that's a monounsaturated fat, as is my favorite avocado. In the polyunsaturated fats, you have things like chia seeds and flax seeds, walnuts, really nuts of all type, cold water fatty fish like salmon. So these are some really good sources of monounsaturated and polyunsaturated fats, which are still very satisfying. It's still 9 calories per gram. It's just not the saturated fat that's going to move you toward cardiovascular disease. Now, of course, you still want a healthy percentage. You don't want to go crazy with your fat, but it's quality and quantity that are very, very key when we're trying to make these dietary choices. And then we flip over to the risk of diabetes with sugar. Your risk goes up like 25% with one sugary drink a day. So, one Coke or some other sort of sweetened beverage like that. Huge trajectory as far as increased risk. So getting back to real food, I have people who are afraid to eat fresh fruit. And it's like fresh fruit is not the same as sugar. It's not the same as fruit juice either. So I always say eat your fruit, drink your water. So we want to eat fresh fruit. Berries are wonderful, citrus is great, but 2 to 3 servings of fresh fruit a day is fabulous. That's not going to make you a diabetic. And I know there's a lot of false data out there, but these are the facts. Now, you might do better with certain fruits versus others. Blueberries seem to be the winner across the board, but there's a lot of great fruit out there. Now, when you're talking about carbs, so often that gets put into a category of carbs. Oh, I'm on a low-carb diet. I stay away from carbs. Carbs are bad. Hopefully what you mean is you're staying away from refined sugar, you're staying away from simple refined carbohydrates like prepackaged, ultra-processed carbohydrates, because those are indeed bad. They're going to shoot your blood sugar up, they're going to cause an insulin spike, and you keep that up and you get what's called insulin sensitivity, where the insulin is not sensitive anymore. So you've got that lack of sensitivity. Sorry, I misspoke. Lack of sensitivity, and insulin can't drive that blood sugar into your cells anymore. Then you get elevated blood sugar in your blood. Now you're told you're a diabetic. So about 10% of the population is diabetic. 38% is pre-diabetic, which means they're moving in that direction. And this was just measuring adults, that statistic of 38%. There's a lot of kids that are pre-diabetic and diabetic because of our terrible diet. So getting back to the carbs, fruits and vegetables are carbs, beans are carbs. Now, when we say it like that, it sounds like there's no fat, it's just a carb 100%. There's very few things that are 100% of anything. Vegetables have some fat in them. There's of course protein in beans and protein in nuts. Yet we tend to think about them in these solitary arenas. So fruits and vegetables are complex carbs. They also have some protein. They also have some fat. And also the beans and legumes. These are complex carbohydrates that are beautiful, and they actually tend to stabilize your blood sugar. They couldn't be more opposite than simple carbs. So you've got the complex carbs and you've got the simple carbs. So this lopping together carbs in one category really does us a disservice again. It's real food, it's high quality food, sure, in a good quantity that makes sense. And then, of course, there's exercise and sleep and, watching your stress level. But I get annoyed when I hear doctors just kind of dismiss Americans as these irresponsible people that are not going to listen to reason, and they're just going to go, well, if I can't have my saturated fat, then where's my sugar? And I'm not saying that doesn't happen, but it doesn't have to happen if we educate you, which is why I'm here. So you can have a very satisfying diet, a very richly flavorful diet without having to choose whether you have heart disease or diabetes. You can say no to both and live a very healthy, long life and really enjoy what you're eating and not feel deprived. So if you need help doing that, my team is here for you. And if you have any questions, definitely let me know. And any topics you'd be interested in, definitely let me know. And if you like this content, give it a thumbs up, subscribe to the channel so more people can see this information, and I'll see you tomorrow.